Hey all, don't be put off by an old man recording at sort of 10 past 12 at night, because I may actually save your life. 13 years ago I had a heart attack. It wasn't the sort of heart attack where you sort of, and drop down dead. Those sort of heart attacks don't exist, because trust me, you know when you're having a heart attack because you get the symptoms like 3-4 months before you have the heart attack. My symptom, and a lot of people's symptoms, are, have a guess. No, you're wrong. The symptom is jaw pain. I had terrible jaw pain 3-4 months before I had the heart attack. I went to the dentist thinking it'd be an abscess up here. So they done the x-ray and all that. Nothing wrong with my teeth. So I then went to the doctors. And the doctor, of course, was, let me have a wee look at you. Could be neuralgia up here. Yeah, neuralgia. I think it's neuralgia. I'll give you a couple of tablets for neuralgia. So it was neuralgia, because 3 months later that neuralgia turned into a heart attack. But I will tell you about the heart attack and lots more about heart disease later on. But I want to get the main symptom over in my first video on jaw pain, because the strange thing is, a couple of years later I bumped into an old friend of mine and we got talking together, and he says, by the way, I had a heart attack and I got a stent fitted. And he said, it's strange you should say that, because I got a stent fitted myself. And I says, did you really? What happened, bub? So he says, well, the funny thing is, he says, I was having these terrible jaw pains. And I sort of went, really? I said, yeah. He says, a terrible jaw pain, and went to the doctor. And the doctor says, well, jaw pain at your age can be a sign of heart disease. So what I'm going to do is I'm going to send you up to the hospital and get you to have a treadmill test. So he went up and he had the treadmill test, and turned out that his heart had problems, because obviously the treadmill spotted it. And he was brought in on a Friday, had the stent, and was released the next day. Whereas if my doctor had spotted it, I would not have had a heart attack on the Sunday and have been kept in the hospital for a week and then had the stent, because it'll always be in my history now that I had a heart attack. Whereas my friend, because his doctor was quick on the ball, he was able to avoid having a heart attack. So if you have jaw pain and you're sort of right about the age group of 50 or so, get yourself up to the hospital and get it checked out, because jaw pain is a defining symptom of heart disease. And with that, I'll wish you good night, and do subscribe to my channel, because I will give you a lot of advice about heart disease, because 13 years later, this boy's still here. Good night.